Good afternoon. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. And I am here with my other Thrive Kentucky colleagues and partner organizations for our virtual end of year Advocacy for Thriving Communities Roadshow. So this is the very last stop that we're going to be making this year. If you've already joined us for a previous roadshow this year, thank you. And I'm glad to see you again. I know I've seen many of you recently at our annual meeting and some other events, so it's great to have folks here today. And you may be here for a refresher, you may be here for the first time. Something that's a little bit different about our virtual roadshow is that we have condensed it to 2 hours. So as usual, we're going to be peppering you with a lot of content, but we will have this recorded. We will be sharing the slides with you if you haven't gotten them already. And in 2024, we'll be having our in-person roadshow series starting again in May. So you can also look forward to that. And with that, I'm going to very briefly go over a few things before we get started. So let's go to the next slide. If you are interested in learning any more about our Thrive Kentucky members, you can do so here. These are live links. Next slide, Alex. So our mission is to make sure that we are addressing the basic needs of all Kentuckians through policy advocacy and systemic change. And these are the guiding principles that really help to shape our work. We can go to the next slide. And in terms of housekeeping, we want to make sure that, everyone has their volume on mute, and that if you have questions or if you have any comments that you want to make, please put those in the chat. We really appreciate people just asking questions and making comments as we go, and we try to get to those, as we're going through each of the sections. Don't feel like you have to wait until the end of the section. And if we ever don't have an answer for you or can't get to every question, then we'll follow up. And we always send out a follow-up email with the slides, with the recording, with answers to questions, and lots of other resources. So you can watch for that probably on Monday, since today is Friday. And we will have a host of other resources for you in addition to what you get today in the slides. We also offer CEUs for social workers and certified community health workers. So if you'd like CEUs for today, you can email Kelly, and Kelly will put her email address in the chat. And there will also be an evaluation that you'll need to take. And of course, we want everyone participating to take that evaluation and give us their feedback. But for CEUs, it's required. We can go to the next slide. These are the objectives for today. We won't go over them. Next slide. And this is our agenda. So this is what we're going to cover in the next 2 hours. We'll start with some advocacy training, and then we'll talk about the issues and the different programs and resources that Kentuckians need to thrive. Let's go to the next slide. Just a quick thank you to our sponsors. We appreciate their support so much, and it helps us to provide all of these training sessions for free, make those trips to different communities throughout Kentucky, provide lunch, provide CEUs. So it is absolutely essential to the work that we do to have this support. And we also appreciate the partnership that we've had with the National Association of Social Workers Kentucky chapter and the Kentucky Office for Community Health Workers. And if you'd like to consider sponsoring in the upcoming year, please reach out to us. Kelly would be your point of contact for that as well. Next slide. All right, and I mentioned that we'll be doing this again starting in May with our roadshow, but before May, we're going to be returning to our usual monthly series of state and federal policy updates. And we'll keep you up to date on everything you need to know about the legislative session, as well as other things that are going on, month to month. So here are some of the dates for that, more to come. And with that, I'm going to turn it over to Dr. Schuster to get us started.
Thanks so much, Emily, and good afternoon to you all. I'm Dr. Sheila Schuster. I'm a licensed psychologist, and I run an organization, an umbrella organization called the Advocacy Action Network. And under that are the Kentucky Mental Health Coalition and the 874K Disabilities Coalition. I'm also the board chair for Kentucky Voices for Health. So happy to be here and happy to talk to you about the upcoming General Assembly and how important your advocacy is with our lawmakers. Next slide, please. So I just want to remind you all that we live in a democracy. I know it's been under attack, and I think there are times when all of us are a little discouraged, but a democracy only exists and only works if the people are engaged. So we are the democracy. It's really not our elected leaders, but we actually make up the democracy. And we don't have a thriving, healthy democracy unless we're engaged. This is one of my coalitions, the 874K Disabilities Coalition. We have 847,000 Kentuckians, probably more than that now. That was the 2000 census, who have a disability of some kind. So this is cross disabilities. This includes people with mobility issues, with sensory issues, with mental illness, substance use disorder, acquired brain injuries, developmental and intellectual disabilities. So for the past 20 years, we have been bringing hundreds of people to the Capitol to engage them in speaking with their legislators. And, this is the largest minority group in any state, if you think about 23% of our population, and often the most dismissed. So it's been a particularly gratifying part of my career to work with people who have been told over and over again, you don't have a voice, and for them to discover that in fact they really do have a voice. And I want that message to come across to you all. You have a voice, and the power of your voice is in your lived experience. You know more about what you're encountering in your communities, in your families, in your part of the state than any legislator does. And so I really hope you will take it as a responsibility to educate your legislators about what's going on and what needs to change. Next, please, Alex. So I go through this to remind you that the legislators are elected by you, whether you particularly voted for your House member or your Senate member. You do have two legislators in the General Assembly. You have also a congressman, and you have two congressional senators who represent you. So they're elected to serve you. The governor, and we just had an election, as you know, Governor Andy Beshear was reelected. He's elected again, whether you voted for him or not, but he's elected by the people. And therefore, the governor and all the executive branch, and you're going to hear some of those executive branch departments and cabinets referred to by some of my colleagues today. So again, a democracy requires that the voice of the people be heard. They cannot serve you unless they hear from you. We can say all kinds of things about them, but they are not mind readers. And so we have to take that responsibility to let them know. And here's the other reason that you really want to be in touch with them. We can't hold them accountable if we've not told them what it is that we need. So if you've been very clear with your legislators and with the legislators' colleagues, you've done the kinds of things we suggest, and calling the message line and emailing them and even coming to Frankfurt to meet with them or to meet with them back home, and told them, several times about the situation that needs to be resolved. And if they haven't done it, then you have something to hold them accountable, because they really do have a responsibility to be responsive to you. Next, Alex. So here's why that voice should be yours. Again, you are more knowledgeable about your issues than anybody in Frankfurt. I think if you talk to some of the more candid legislators, they will say, my knowledge is kind of a football field wide, but it's about a quarter of an inch deep. In other words, I have to know about lots of things, but I really don't know in depth. You know your issues in depth, and so that makes you extremely knowledgeable and valuable. One of the things you want to do is to provide accurate information. And I've been doing these advocacy trainings for more years than I can count. And one of the things I hear back from the audience, no matter who it is, whether they have advanced degrees or no degree, or whether they've been to Frankfurt before or not, one of the concerns is, I'm afraid I'm going to meet with a legislator and they're going to ask me a question and I'm not going to know the answer. And that's going to make me feel dumb, and it's going to make me feel like I've let the legislator down. Actually, the golden opportunity for you. And I've been going to Frankfurt for 45 years, and I never have a session that I haven't been asked at least several questions that I don't know the answer to. So here's what you want to do. Let's say that you're meeting with your senator, Senator Jones, and you're talking about your issue, and you really feel like he's listening to you and so forth. And then he says to you, What's the budget impact of that? That's what we call in psychology a demand situation. There's somebody in power and they're talking to you and they're asking you a question. So your immediate thought is, oh, I guess he assumes I have an answer, so I better come up with an answer. Please do not do that. I don't care how good a BSer you are and how good you were in school. Do not pull an answer out of your left ear. What you want to do is to provide accurate information. So this is where it's a golden opportunity for you to connect with that legislator again. So what you want to do is to say, Senator Jones, that is a great question. I don't have that information, but I will get it for you. What's the best way for me to get it back to you? And if you're making a connection, and if that's your senator, very often these days, they will say either don't use the LRC email address because it gets all bollocksed up. Here's a different email address you can use. Or some of them will say, here's my cell phone, text me when you have the information, or call me and leave me a message. Or here's somebody in my office that's working on this. Here's their contact information. You can get it back to them. And then, for gosh sakes, do your homework and try to get an answer, or at least some semblance of an answer. If you can't find out the exact budget implications in Kentucky, but you have some numbers from Arkansas or Mississippi, I suggest using southern states as your examples. Get that back to them. But you want to have a working relationship with that legislator, and you want that legislator to know you're willing to do your homework and you're going to provide accurate information. We have access to what we call the free media. I've never had the pleasure, I guess, of working for anybody that had enough money to buy media ads or to put money into media. So you know that the newspapers and the TV reporters and the radio reporters, when they talk about an issue, they don't get up in the weeds about what this issue is policy-wise. They will tell a story. They'll tell a story about somebody that's been affected by this issue. And that's where you come in. You can be the source of that story. We'll talk about that later. Or you can know some people that can tell that story to the media, and that way educate more people. We can rally grassroots for supports, and one of the ways we do that is to work in coalitions, and we'll talk a little bit more about the best way to work in coalitions. But it does require that you speak up and that you do it often. Next, please, Alex. So here's my guilt slide. Get ready. This is one of the gatherings of the 874K people back when there was a community center in Frankfurt, a civic center. If you don't speak out, who will? Who knows those issues better than you do? And you can be at a meeting, or you can look to your right and left and say, oh, I don't need to because so-and-so is going to do it. Well, you better check with so-and-so and make sure they're going to do it. So again, policymakers cannot serve us unless they hear from us. And you cannot have a working relationship with a policymaker if you have not spoken with them. So take on that responsibility, please. Next, please. So just a reminder, we have a Senate and a House. We have 38 members in the Kentucky Senate. There are 31 Republicans and 7 Democrats. There is a new senator. He was elected in the primary to replace Senator Ralph Alvarado. So he's from Winchester, and his district includes some of Fayette County and some of Scott County, and so up in that neck of the woods. There are 100 members in the Kentucky House. We have 80 Republicans and 20 Democrats. And we have a brand new Democrat who was elected in the special election on November 7th, and that's Adrielle Camule. And she's from the far eastern part of Lexington. She replaced, unfortunately, we lost Representative Lamine Swan to an untimely death, and she's been elected. So if you live in those districts, make a concerted effort to reach out and introduce yourself, because they don't know many people coming into the General Assembly meetings in January. Next, please. So our interim session has just ended. The interim is a time when they take a little bit more time in their committee and task force meetings to really delve into an issue. They can't take votes, but it's been a very, very busy interim session. There were special committees known as task forces that were appointed, and they're listed on the next slide. If you could go to the next slide, Alex. Some of those that we were particularly watching was the one on the Cabinet for Health and Family Services. Lots of discussion about Medicaid, lots of discussion about community health workers, lots of discussion about budget issues and so forth. Another one that we were watching, particularly on my part on mental health, was the School and Campus Security Task Force that devoted itself to school safety and school mental health. Jails and corrections, that's an issue that we have more people that are incarcerated in Kentucky than almost every other state. We have more kids who have a parent who's incarcerated. So looking for some reforms there. And then probably one of the liveliest task forces was on something called Certificate of Need. And so there are medical services and facilities like freestanding birthing centers that have not been able to be established because of the constraints of Certificate of Need. So there was some very lively discussion and debate, and we will look at those findings and recommendations that are still trickling in, I think, and we'll get those to you as we have them. Next, please. We also had an on-again, off-again battle around Medicaid regulations to improve vision, hearing, and dental services. This was announced in July of 2022 by Governor Beshear, went into effect in early January, and really provided adults on Medicaid with eyeglasses or contacts, hearing exams and hearing aids, cleanings, dentures, root canals, fillings, or extractions. And we have, unfortunately, one of the highest rates of toothlessness in Kentucky. And then we got into a power struggle, quite frankly, between the Democratic governor and the Republican legislature about whether the funding needed to be approved by the General Assembly. But those services are still going on, and we have hundreds of thousands of people that now have glasses and hearing aids and have gotten dental work started or completed. So those services are in place at least through the first of the new year, and we'll kind of see what shape it takes in the upcoming session in terms. But for right now, if you are on Medicaid or have a family member or know of someone who's an adult on Medicaid, get them in there to the dentist, to the audiologist, and to the ophthalmologist or optometrist. Next, please. So 2024, I know we just finished an election, and like, if you're like me, you're tired of hearing all the commercials on radio and television and splashed all over the newspaper and so forth. So we put that aside, we finished that election, and now we're back into it. And this time it's about the legislators. So all 100 of the House seats are potentially on that ballot, and half of the Kentucky seats will potentially be on that ballot. The filing deadline, meaning the deadline for candidates to announce that they're going to run for an office, is earlier than ever, January 5th. So we're going to know in the next 3 weeks, I guess that is, who for sure is going to run for an elected office. This also includes our 6 congressional congressmen. Be sure you're registered to vote, and they've made it easier to do this online. Go vote ky.gov to check your registrations and register. The primary election will be on May 21st, and there will be some hotly contested primaries, I believe, for these legislative seats. And the deadline to register is April 22nd, and then the general election is on November 5th. So things will really heat up close to that May 21st election, and then things will die down a little bit. And then starting in late August, there will be a huge push toward that general election on November 5th. And remember, as we found out, that elections have many consequences. Next, please. So you have 2 ways to participate in our democracy: your voice to speak up and your vote. And you have not only your own, but your ability to influence others. If you've got a young person in your family or in your neighborhood that's going to turn 18 in 2024, chances are they can register. If they're going to turn 18 before November 5th, they can register and vote. So reach out and let's get more young people engaged in voting. There also is a big campaign to get people who have been previously incarcerated and have had their voting rights restored by executive order, but many of them don't know that. So there's huge campaign going on. Again, if you know someone in that category, reach out to them. Next, please. So what comes next in 2024? We're going to have the same governor and many of the same executive branch personnel. There will be a new attorney general, new auditor, new treasurer, and new agriculture commissioner. The secretary of state was the only statewide office that was reelected. It's a long session, 60 days, running from January 2nd to April 15th. The most important thing they will do is the biennial budget. That is really the policy document. That's the priorities of the legislature. You know, when you do your own budget for your workplace or for home, you put at the top the things that are absolute necessities, so a place to live, food, clothing, education, those kinds of things, and then you work down to maybe having a little fun time money. So we want the legislature to put people first, and we have lots and lots of requests for people on Medicaid to get their waiver services that they've been waiting years for, to do SMI services for people with severe mental illness, to fund childcare, and you're going to hear about that later on, to fund affordable housing, all of those things. We are talking, or we're hearing about possible ballot referendum. They would have to pass a bill in the legislature to put a referendum on the November ballot. We think there will be one on school choice. Do you want to have public monies going to charter schools or to parochial or private schools? Possible changes in the abortion prohibitions. We're hoping for more communication between the executive branch, the governor, the legislative branch, the General Assembly. Next, please. So this is my therapy slide. If I was seeing you in therapy and you came in week after week after week complaining about a situation but doing nothing about it, at some point I'm probably going to say to you, you know what? You need to decide either to let it go and just be a victim of it, or to do something about it. So I feel that same way about Frankfurt, and that's not to say that everything they do is negative or has a harmful effect, but we are the recipients of everything they do. And so I don't think that we can afford to stand silently on the sidelines and not get involved and interactive with the process. So remembering that everything that happens in Frankfurt affects us, I think we have a duty and a responsibility to get involved. Next, please, Alex. So lots of ways to engage your community, and you're going to get these slides, but think about all the people that don't know about your issue that could be on your side. I'll give you an example. When we were trying to get the insurers to cover mental health, which they were unwilling to do, we got the faith community involved, and people said to me, legislators said, why do they care? It was a social justice issue. The insurers were discriminating against people who had a brain disorder, and the faith community and a number of other groups didn't like it. We've worked on reentry for people with substance use disorder, and one of our unlikely allies in some ways, the Chamber of Commerce. Why? Because they need more people in the workforce, and if there's a barrier because of a criminal record that needs to be expunged or whatever, they want to work on that. So you can have rallies and press conferences in your community, and in Frankfurt, you can have calls to action. Use social media. Legislators increasingly use Facebook even to schedule appointments, to tweet and so forth. If you live outside of Frankfurt, Louisville, Lexington, everybody's welcome to visit with their legislator, but the more rural legislators love it if you are willing to come to Frankfurt. So these are some other helpful tips for you. Next, please, Alex. So the most powerful statement you can make to your legislator is, I am your constituent, meaning I live in your district and I vote. And that's so powerful because you have the power to vote them out of office. They can listen to me, and they have sometimes, and sometimes they just ignore me, but I don't have that power to vote them, keep them in office or to vote them out. You also can make a statement if you work for an agency or you work outside of your own district, but in the district of a legislator, you can say, I work at the local community mental health center, and so we serve many of your constituents, and that's why I'm talking to you about this. I just want to remind you that this is not a John Calipari one and done. This is not just, one time I'm going to ask and then I'm going to expect you to do what I asked you to do. You want to have an ongoing relationship. You want to stay in touch with them. You want this to be an ongoing process. Next, please. So one of the things that Kentucky Voices for Health does so well is storytelling. And we have on the webinar, Holly Hudbill, who is our storyteller. We have a videographer. We want people, what they're not going to remember actually the facts and figures. You've got to have that. You've got to show that you've got your done your homework. They will remember the stories. And one of the things that we're suggesting to people, if you're going to go to Frankfurt from, let's say, Morgantown, and you've got a friend who has a great story to tell, but they can't get there, have your friend tell the story on your cell phone. And when you meet then with Senator Jones, you say, Mrs. So-and-so lives at such and such a street as a constituent. Here's what she wanted to say to you. And if she has a compelling story, that's what's going to get remembered. And that's what you want people to think about in terms of policy. Next, please. So this is the contact information for Holly. And again, that reminder that I can, as a psychologist, tell the stories, but it's always someone from the National Alliance on Mental Illness or a consumer themselves who is the most compelling person to really carry that message and tell their own story. Next, please. So I want to remind you that we're at a time of such partisan divide. And so a lot of people I'm hearing from are, I don't want to get involved in politics. Our issues are not political. Healthcare access is not a political issue. Housing is not a political issue. It's not red or blue. The process of getting policy done is political, but do not hesitate to talk with your legislators about these basic needs that we're talking about today and what affects the people in their district. So yes, it's helpful to know that the Republicans have a supermajority, but the Democrats continue to have a voice. Those in leadership have great influence, but everybody has a vote and a voice. So don't shy away from this because of the kind of political divide. Next, please. Here's all kinds of ways to stay in touch. I've given you here the legislature LRC website to find out who your legislators are, to find out some background about them. Here's the way to email them. If you're emailing your own representative or senator, put in the subject line, "I am your constituent," and put your home address in there. Next, please. So some of you may work for agencies who say, well, we can't lobby. You can always educate about an issue, and we have some materials for you here. And I think on the next slide, go to the next slide, please. Yeah, that give you some really good examples about the difference between advocating and lobbying. So you can talk to a legislator until you're blue in the face about what happens when people are exposed to secondhand smoke without going over the line and saying, please vote for Senate Bill whatever or House Bill whatever. Next, please. Remember that all politics are local. So I will tell you that those who have joined us from the more rural areas, you have as much or more power. I think sometimes people in the rural areas figure, well, if you're not from Louisville, Lexington, or Frankfurt, the truth is that if you look at the leadership in the House and Senate on the Republican side, the majority of those leaders are from rural communities. So your local leaders and your local contacts with your local press are so, so, so important. Actually, sometimes I wish I weren't from Louisville. I wish I were from a more remote part of the state because they really do get legislators' attention. Next, please. So here's all kinds of ways to stay engaged. And again, remember that this is a process. This is just so very important. And I think maybe we have one more slide. Yeah, so here's the way. The message line is critical, 1-800-372-7181. The people that answered the phone, I don't know what medication they're on, but they are uniformly positive, helpful. I've never heard one of them get short with somebody or lose their temper or whatever. So call that number. I also will put in a plug, and we should have put it on the slide. Emily Beauregard and I will be doing an Advocacy 101 on January 8th. And it's free, but you have to register, and we will get that link out to you. We would love to have you join us. We go into much more detail about how a bill becomes a law. And then we will have two legislators, Representative Lisa Wilner and Representative Kim Banta, to answer your questions. So it's 11 to 2 on January 8th. And I think, is that my last slide? Yep. I'm happy to turn it over to my colleague, Dustin Pugel, to talk about economics. Thank you.
Well, Sheila, you're always a tough act to follow, but it's especially tough when I have to talk about a bunch of numbers. So anyhow, I'm Dustin Pugel with the Kentucky Center for Economic Policy, a proud member of ThriveKY, and we like to start things off with some advocacy training, but we also like to try and set the landscape a little bit for the economic conditions that create the need that a lot of these programs are designed to meet, but also talking a little bit about how we pay for it and some issues related to that. So if we move on to the next slide, we'll go ahead and get started. Just a quick note to say that, while we have really seen a lot of hardship over the last several years, our jobs recovery has been remarkable. We are now about 4% above where we were in February 2020 before the pandemic and the subsequent downturn hit. And that has been really remarkable. And while that hasn't necessarily affected all parts of the state equally, or all types of folks equally, or even all industries equally, it is much faster than we saw with the Great Recession, and has been really, really impressive compared to historic standards. So let's move on to the next slide. So I mentioned a second ago that it didn't hit all sectors equally, and that's because really what pushed us over the edge in terms of having a really speedy recovery was a massive amount of federal investment. So just looking at the 4 bills that were designed to alleviate hardship during the downturn, Kentucky got over $45 billion from the federal government, which is an enormous amount of money. And that was in the form of stimulus checks, boosted unemployment benefits, direct aid to state and local governments, as well as universities and schools, PPP loans, the boosted child tax credit, and a lot of other types of public health aid. And that was really to try and stop the bottom from falling out, which it did, and keep people whole so that folks could continue buying things that other people make and sell. So it kept people on the job. It helped other people get back on the job more quickly. And then just last year and the year before, there were 3 other laws that were passed that were significant and long-term investments in the state. Those are the Inflation Reduction Act, the Bipartisan Infrastructure Law, and the CHIPS and Science Act. Between those 3, Kentucky's already started over 1,900 projects in the state, including the Brent Spence Bridge and other sort of big name projects. And what that's done is really created a huge boom in construction jobs. It's also helped other industries, but what we're seeing is work being done already on roads and bridges, airports, abandoned mines and orphaned wells, improved transportation, and more manufacturing. Those are all really good things. Those are typically good paying jobs that really help folks to be able to put food on the table and move their families ahead. So let's move on to the next slide. Now, while the jobs boom has been happening, we've also, I'm sure everyone noticed that stuff costs more than it used to. Inflation really spiked toward the end of 2020, beginning of 2021, but it peaked about the middle of last year. So for the last 18 months almost, we've been seeing inflation rapidly fall. So for example, just to take one item, that green line there that you're looking at is the inflation rate for food. So that's the pace at which food is becoming more expensive. It peaked in August of 2022 and at 11.4%. It's back down to 2.9%. So prices are still not back where we want to be, which is around 2%, where most of us don't really even notice it. But we're heading in that direction, and we're doing so really, really quickly. So that's good news as well. So let's move on to the next slide. Now, we're going to talk about housing assistance and food assistance and Medicaid and a lot of other things. All of those are typically shared responsibilities between the state and federal government, but in all cases, the state has something to pitch in related to it. And one of the ways, actually the strongest way we do that, is through our income tax. Now, folks may have heard that there's a plan to cut our income tax over time. I'm going to talk a lot about that, but just to start by, I want to start by saying that the income tax is our largest source of revenue. It's our strongest source of revenue. It doesn't change as much with downturns, and it's better at growing with the economy because incomes at the top tend to mirror the economy pretty well. So when you're taxing incomes at the top as well as everyone else, you're able to keep up with changes in the economy better than you are with, say, the sales tax or corporate taxes. So let's move on to the next slide. However, there is what I refer to as the plan to run out of money, which is our plan to march towards zero with the income tax, so to speak. There is a sort of two-factor mechanism by which the General Assembly can reduce our income tax a 0.5 percentage point at a time, which may not sound like much, but that can be around $800 million per year. So it's quite a bit of money. Those two conditions are if we have a 10% of what we typically spend in our state savings account. It's called the Budget Reserve Trust Fund. And the second is that we're bringing in at least 1% more in taxes than we're spending right now. And those were set up to sort of slow the process, to make it deliberative. But what it also does is it creates a double disincentive for spending. On the one hand, you have less to spend to begin with. And on the other, you're encouraged to put more into the Budget Reserve Trust Fund and spend less in our general fund. And that's a real problem because we have a lot of needs right now as a state, and we have a lot of things we need to pay for. So let's move on to the next slide. Just to give an example of how much this costs, a couple of years ago, the estimate was that a reduction of 1 percentage point in the income tax was worth about half of what we pay for Medicaid and more than we pay for all of our post-secondary education institutions. So it is a very expensive move, even for what may seem like a small number. And that means we have less, again, to pay for the things that we need. So let's move on to the next slide. While it doesn't necessarily benefit the programs that we're trying to fund, it does benefit wealthy people. So 65% of the benefit goes to the top 20% earners in the state, and 20% of the benefit goes to the top 1%, folks who earn $514,000 or more. On average, that income bracket in Kentucky earns $1.4 million, and they're taking home $1 out of $5 worth of that income tax cut. So the poorest million Kentuckians don't get anything because low-income Kentuckians don't pay an income tax in the state because we have a certain type of deduction for them. So this is not a useful thing to most Kentuckians. Let's move on to the next slide. We're headed into a budget year. And so like I said before, there's this double disincentive for future spending. We are already hearing that, we need to have a continuation budget. We need to practice spending restraint. We're going to see a lot of things frozen. But as we saw in that inflation slide, a freeze is really a cut, because while you're freezing the amount of spending, prices keep going up and wages keep going up. And it creates a real strain on education and healthcare and all the other parts of our state government. And let's go on to the next slide. And at the same time, again, because of the way we've designed this trigger, we actually have a lot of money to spend right now. We have a structural surplus each year of over $1 billion. And what we've been doing is just pumping that into our Budget Reserve Trust Fund so that, while experts suggest that the most you would want to have in a Budget Reserve Trust Fund is about 15%, we're headed toward almost a third of our general fund next fiscal year if we continue the pace we're at. 2 years out, we're talking about half of the general fund in our Budget Reserve Trust Fund instead of in the communities that really need those investments. So I think as we continue with these slides and you keep what Dr. Schuster had in mind, just remember that we have a lot of money right now, and we really need to spend that on things that benefit all of us, not just the wealthy. So let's move on to the next slide. I think I'm handing it over to Priscilla.
Thanks, Justin. All right, so today we're going to, of course, talk about Medicaid renewals, which we've been talking about all year, but now is a really great time for an update of how things are going. So next slide. So for those who may not know, the federal public health emergency ended May 11th, 2023, and at the end of March, March 31st, the maintenance of effort provision that allowed folks who've been enrolled in Medicaid since March 2020 came to an end. And so what that means for Kentuckians and really all across the country, that everyone has to go through Medicaid renewals. They have to have their case reviewed and reevaluated to see if they're still eligible. So renewals restarted on April 1st, with the first batch of folks being due for renewal at the end of May. And since then, since the end of November, 637,000 Kentuckians have gone through this renewal process. That's 637,000 of 1.7 million. So we're like a third of the way there, which is kind of ridiculous to think about 6 months later. But these will continue through the end of April 2024. And then after that, it's a return to normal with a small caveat. So one of the things that Kentucky did, and is the first in the country to do, they extended the coverage for kids through the end of unwinding. So it's over 600,000. We don't have the exact number of how many kids are impacted, but around 660,000 kids are enrolled in Medicaid, and they've all been moved to the end of the unwinding period. And that's one, to take a lot of the pressure off of the state. So that's 600,000 fewer cases that they have to process. But also to make sure, more importantly, to make sure that kids stay protected and covered. We don't want to see anyone lose coverage, but it's so critically important that we make sure that we're protecting kids throughout this. So all of this, kids have been extended through the end of the unwinding period, and they will go through their sort of a separate renewal process beginning in May and throughout the following 12 months. So no kids, let me just make sure, no kids should lose their coverage between now and really the end of unwinding, unless they move out of state, their parents contact DMS and say, hey, please cancel this coverage, or unless they pass away. If you know any kids who lose coverage, that is a big deal and it needs to be escalated. So please reach out to a connector, or reach out to me. Happy to connect you with someone, pun intended, to make sure that no kids lose their coverage, because we do want to make sure that folks stay protected. Also, same for adults. We don't want any adults to lose coverage. So if you know anyone who's lost their coverage, please reach out to a connector, and they can help make sure that folks stay enrolled in something, because we don't want to see folks go uninsured. So with all of the Medicaid renewals, there's lots of good data that's coming out. The state has a unwinding website that is linked on the page, medicaidunwinding.ky.gov. There's lots of great resources and outreach material. And then there are monthly data reports that live on that website, and frequently asked questions. So it's a good resource to check into. And if you know anyone who has Medicaid and has not had to go through the renewal yet, you can check their renewal dates in the system. You can log into the Connect self-service portal, reach out to a connector, call the Connect hotline, or if you're in a provider's office, you can ask your provider to check KY HealthNet to check for that date. So super important to just know when those dates are, and if you have any problems or questions or anything like that, please reach out to a connector for help. All right, next slide, please. All right, so over the, since unwinding has started and as we move forward, folks will receive one of these 3 notices. The first one is a notice of eligibility. The notice of eligibility generally says, hey, we've checked your eligibility. We think you're still eligible for Medicaid. It's been extended for another 12 months, and then you don't have to do anything else. For the next notice is a request for information. That's an RFI. They usually request information about your income. So they'll ask for pay stubs or just updated income information. You do have to mail that back in, or you can upload it into the Connect self-service portal, or take it to DCVS or fax it in. One of those 4 ways, but you do have to take action to keep your Medicaid. and if you receive that request for information. Also, the other option is a Medicaid renewal packet, which is a full packet of has all of the case information that's available, and it's pre-populated, so everything that's in the household and on that case is on that renewal packet. You just have to walk through it, make sure the information is up to date, make any changes, you can just write on it and then sign it, and then you have to either mail it back or take it back directly to the DCBS office. So with the RFI and the renewal packet, you do have to take action to keep your coverage, but with the notice of eligibility, you do not. So next slide. So far, like I said, here's a good breakdown of individual renewals and Medicaid approvals and terminations. One of the things that we are keeping a really close track on, we've been watching the terminations since they started, but in September and October, back in September, they started doing, they implemented a new flexibility that allows folks to, if they did not respond to a notice or if they have problems responding to a notice, their coverage was extended for another 30 days instead of automatically being terminated, to allow folks to have more time to submit those needed documents or to respond to that RFI or send in that renewal packet. And so beginning in September, we've seen bigger buckets of folks who have been extended and had their coverage extended for an extra 30 days. Right now, we still don't know what, after 30 days, what's happened to those folks. So that is information that we're still trying to work with the state to get a better understanding of what's happening. But right now, overall, most people, our termination rate has gone down a lot, and our no response rate has gone down, specifically because they've extended coverage for another 30 days. So next slide. Okay, and so one of the things, so if you do lose your coverage, there's a 90-day reconsideration period. So during that 90-day reconsideration period, you can just submit in those requested documents, the renewal packet, the proof of your updated income or all of that. If you turn that back in, you don't have to fill out a new application. They can still evaluate your case just based on the submitted documents, and then they can reinstate coverage back to the date of loss. So the May, June, and July, and now August windows have closed, that 90-day window, so we can see how many reinstatements there have been. That means there continues to be casework and paperwork processed every day, and so as folks submit those documents, they're processed, they have their coverage reinstated. So this is just an update of that. Next slide, please. So overall, this is since the end of October, we are still looking for the November updated numbers, but as of the end of October, 578,000 Kentuckians have had their renewals, and so most folks have been approved, 60% approval rate overall. But what we're really focused on is that 156,000 who were terminated, and 57% of those were for procedural reasons, meaning those are folks who did not turn in their documents, and they were terminated not because they were not eligible or not because they were found ineligible, but because they did not turn in their documents. So we really want to make sure that we're finding people and meeting people where they are, getting them that information so that they do turn that information. We don't want folks to assume they're not eligible. It's really important to at least submit the documents and let the state make the decision for you. This is particularly important for kids because the eligibility rates can be different, but super important. 57% is just a really high number of folks to not submit those documents. So if you know problems or issues that are going on that are keeping or preventing people from being able to submit those documents or getting things processed properly, please report that to us. We are tracking all of these issues very closely, working with other connectors, and you need all of that information so that we can figure out what's going on here. And if you have any other ideas for outreach or anything like that, please reach out to me directly as well. Next slide, please. Okay, and starting in September, they've now started putting out these new monthly demographic reports. There's a good breakdown by race, gender, ethnicity, and age group, as well as county by county approval and terminations. That information is not available for any of the renewals before September, but they are September and moving forward. So each month they will be posting a new report. So it was a good breakdown of that month's renewal data. Next slide. Okay, if you lose your coverage, if you lose coverage, you can always reach out to a connector, report it to help report a change on your application, or call the call center. If you lose your coverage and you've turned in documents, they say that you're ineligible, you can always ask for a reconsideration, or if you submit that document, they still say you're ineligible, you can always request an appeal. You have 120 days to request a fair hearing. It's very simple, and it's a good option to make sure that you get your coverage. But if you need help with any of that, please reach out to a connector. The connectors can walk you through this entire process and sort of explain all of the different options at all of the steps. Next slide, please. Okay, the state is doing monthly stakeholder meetings. The next one is the 21st. You can register here at that link there, and they go through all of the renewal data and information each month. So a good opportunity to ask questions and hear directly from the state. Next slide. Like I said, there are lots of issues that are popping up that we're tracking. And if you know of any issues or problems, please reach out. You can reach out directly to me or reach out to a connector to make sure that those folks are having their cases solved and they can keep their coverage or get connected to new coverage. Next slide. Okay, it is open enrollment. Today is actually the first deadline to have coverage by January 1st. You can do that for a qualified health plan. You can do that on connect.ky.gov, or again, reach out to a connector. Medicaid open enrollment is always open. So if you know folks who are uninsured and need to get connected to coverage, you can always apply also on connect.ky.gov. The open enrollment period for NCOs, that is different this year. So folks can change their NCO at any time throughout the next 12 months through now through the end of December 2024 without cause, multiple times a year if necessary. So that's really cool. Medicaid open enrollment just ended last week. But if you need any help with any of this, reach out to a connector or find a SHIP coordinator if you need help with Medicare. Next slide. Scrolling through, we're still in open enrollment, so you don't have to worry about that part right now. We have agents on demand. I just want to make sure agents are available to help connect to QHPs, but they are paid a commission to assist with QHP enrollments. And the difference between an agent and a connector, the connectors are a free resource available in all 120 counties. They can help with Medicaid, KTAP, QHPs, KTAP, and CTAP, and any other programs available on Connect. So we love both, but just make sure you understand the difference. Next slide. And just a warning with all of the folks who are going through Medicaid renewals, there has been a huge increase in scams. Make sure that you are only going through enrollment on connect.ky.gov. There are only 4 insurance companies who sell approved qualified health plans through Connect: Anthem, CareSource, Passport by Molina, and Ambetter by WellCare. And it's really important. No one who's selling you a legit plan is ever going to ask you about pre-existing conditions or any of your health information. If you get any cold calls asking for any of that, please hang up. And again, reach out to a connector specifically, and they can help you. If you get caught up and you might get enrolled in a scam plan or something that doesn't sound legit, please reach out to a connector. They can help you get enrolled in a qualified health plan. That again will cover all of your essential health benefits and won't be based on your private health information. Next slide. And then we need more connectors. I've talked about them a lot throughout this whole thing. We need more connectors. If you would like to become a connector in your organization or in your community, here's some information and you can complete that application. If you have any questions about what it takes to be a connector or what sort of training goes into that, please also reach out to me. So happy to encourage more folks to be connectors. And with that, I will wrap it up and pass it on to Kimmy.
Hey y'all, I am Kimmy Ishmael with Community Farm Alliance. If you're not familiar with Community Farm Alliance, we help farmers and we focus on feeding and food programs from the farmer's perspective. But I'm also a part of the Kentucky Food Action Network, and we are a network that tries to bridge the gap between farmer and consumer. So more local food to people who are food insecure is our main goal. Next slide. So, just really quick, the state of hunger in Kentucky is really, really bad. Um, we have over 500,000 people in Kentucky currently facing hunger. Our Kentucky children are some of the highest percentage of impacted people being food insecure. We actually also have our largest city, which is Louisville. 1 in 5 Louisvillians live in a food desert currently. We have 4 counties in Kentucky that rank in the top 5 food insecurity and most poverty-stricken areas. Next slide, please. And see here. So, and a big challenge also was food prices this year and inflation, and that also put a strain on our food banks. Some of our biggest food banks couldn't purchase enough food that they were currently purchasing, and that trying to reach that has been really hard. There were a lot of pandemic relief programs that really helped. Unfortunately, all the ones listed here are now gone, except for summer EBT, which will be continued and made permanent. Next slide. So there are some anti-hunger and feeding programs, and these are our federal programs. So the ones you all might be most familiar with, which is SNAP, the Supplemental Nutrition Assistance Program, that is for, previously known as food stamps. We have WIC, which is Women, Infants, and Children, the National School Lunch Program, and then, like I'd mentioned, summer EBT. See, and also I do want to note that the bottom 3, the WIC school lunch program and summer EBT, those participation in those programs, that does not negatively impact any non-citizen that's trying to gain citizenship, and proof of citizenship is not required for participation in those programs, but that is different for SNAP. Next slide, please. So there are some local farmers market programs that I would like to lift up, like the Seniors Farmers Market Nutrition Program, Kentucky Double Dollars, which allows participants in SNAP to double their money 1-for-1 at local farmers markets. If you are connected to a market and want your market to participate, the enrollment and application process is open now. And then the produce prescription programs that are being currently offered to mothers on Medicaid. Next slide, please. So talking about SNAP, there are some new reporting requirements. So starting in February of 2018, the state of Kentucky began reinstating a 3-month SNAP limit work requirement in about 92 counties. And that was for Kentuckians with no children or disabilities. Those subject to the rule can only miss meeting the requirement for 3 months in 3 years, which is the time limit, or just lose their benefits altogether. The result of that in 2018 made thousands of Kentuckians lose their food assistance because they could not meet that reporting requirement. But during the pandemic, that was waived. But unfortunately, now that is no longer being waived and is being reinstated in Kentucky. So it was reinstated in July for ages 18 to 49, then in September for ages 50 to 52. And then the expansion of the debt ceiling bill does include people up to 54, which will be phased in 2024, making around 30,000 people of Kentuckians possibly losing their benefits. The only way you're exempt from this is if you are unable to work due to a physical or mental limitation, pregnant, or if you have someone under 18 in your SNAP household. Next slide, please. And when we talk about SNAP, there are things that people like to bring up that are misconceptions, which is fraud in SNAP. So so when it comes to fraud in SNAP, actually less than 1/4 of 1% is actual fraud. And even in that percentage, majority of those fraud cases are actually done by either the retail place or like a process mistake by the office. There is actual fraud happening, and it's with EBT skimming. This is when a scammer will replace a card reader and will actually steal the beneficiaries' benefits, the SNAP users' benefits. There is a temporary fix currently in the appropriations bill, but that will only allow for you to be reimbursed up to 2 months of your benefits. If you know someone or know a retailer who has encountered this kind of fraud, please contact DCBS. Next slide. There are lots of advocacy opportunities when it comes to Kentucky Food Action Network. Like I said, we try to connect farmers to people who are food insecure. We do advocacy on the federal and state levels as well. And there are some resources that you all will receive, like food bank maps, as well as getting in touch with a SNAP connector, and then the WIC website for some resources. And next slide. And I'll pass it off to Adrian.
Hi, everyone. It's good to be with you, Adrian Bush. Next slide. Okay, so we're often asked the question at the Homeless and Housing Coalition of Kentucky, why is housing so hard? And there are a lot of complicating factors on the left side of the slide, but the bottom line is, on the right-hand side of the slide, is that we're short housing. It's like a game of musical chairs. There are not enough chairs. Substitute the chairs for housing. You start to see the problem. Next slide. What does that result in? Homelessness and housing insecurity. So we're going to cover the point in time count trends through 2023. The next count will happen in January. This happens annually. And so you can see that from about 2013 on, for the last 10 years, homelessness had been declining. There was a deep drop in 2021, but that was because of the methodology used. And then it has started to tick back up. And those are the 2023 preliminary figures. Pie chart on the right shows you that this is not just a Lexington problem. It's not just a Louisville problem. It is all across the state. Next slide. All right, so why do we tie homelessness and rents? Because people who are renting are the extremely low income folks, maybe the ones going in and out of homelessness as rents go up. The 2023 Kentucky housing profile can show you the shortage that we have, again, about 90,000, as well as who are our extremely low income renters across Kentucky and the housing cost burden by the income group. There's additional information available by your congressional district. Next slide. The National Low Income Housing Coalition, which published the state housing profile on the last slide, also publishes an out of reach report. And that discusses the state housing wage, what it actually takes to be able to afford housing in Kentucky. And on average in Kentucky, the state housing wage is $17.90 per hour. It may be lower in some places and maybe higher in others. For example, the last place we were in Paducah, the housing wage there is $16.88 per 2-bedroom home. Next slide. All right, so we've talked a lot about pandemic relief programs and what still remains, and the answer is not a whole lot. For renters, we do have an eviction diversion program in 118 counties run by Kentucky Housing Corporation. This is for folks who have an eviction notice in hand. Next slide. In all 120 counties, we have the homeownership assistance fund that still remains, and funds are expected to last there through about 2025. Next slide. All right, so the federal outlook. Housing funding. Right now, we're operating under a continuing resolution on housing and urban development funding through January 19th. After that, there's a big old question mark whether there will be another continuing resolution, a government shutdown. We're not really sure. On the policy side, we have some anti-housing first efforts. Housing first is just a program model that puts the housing where it needs to be in front and then deals with complicating factors after the person is rehoused. There's a bill that's been introduced by Representative Andy Barr that would require HUD to dilute its homelessness funding to include programs that only provide temporary accommodations for recovery participants, and that does not touch the entire homeless population. Next slide. All right, so looking backward real quick. In 2023, the state legislature passed a rural housing trust fund that was designed to address disaster housing activity and needs as a bridge between federal resources. So that money is currently being deployed. We also saw the passage of House Bill 21 that streamlined the process for IDs for people experiencing homelessness, making it easier for them to apply for housing, jobs, benefits, you name it. It also reduced the cost to obtain such an ID. Next slide. All right, so looking ahead to the 2024 regular session, we're looking at issues of supply to address that 90,000 home deficit. We'll be looking for investments in the Rural Housing Trust Fund, as well as the Affordable Housing Trust Fund. The Affordable Housing Trust Fund can serve all 120 counties and can provide funding for multifamily rental development, home repair, and home ownership. We're looking at issues of access, making it easier to obtain benefits and housing and employment and connection to community. So a couple of years ago, we were successful in getting a bill passed that made birth certificates for youth experiencing homelessness free. We are looking at expanding that to the entire population of people experiencing homelessness. We're also looking at increasing shelter capacity. We have a real dearth of shelter providers across the state, and even in Louisville, where we think we have a lot of resources, and trying to address the need of unsheltered folks. We're looking at what that would take. And then on the landlord-tenant side, landlord-tenant law, there has been work done over the past session or two on eviction expungement, and we expect that to hopefully move forward this session. Next slide. All right. Also in the state legislative outlook, there are some not so positive developments. One is an omnibus public safety anti-crime bill that's been called the Safer Kentucky Act. This morning, the bill sponsor and some other folks presented on this legislation. We received a copy of it late last night. But there are lots of pieces to this bill. From a housing perspective, we have some real concerns about it. One, about targeting homeless populations and banning street camping in public places. It would basically make it illegal to be out on the street, which is defined very, very broadly. Your first offense would be a violation, but after that, it moves very quickly to a Class B misdemeanor. There are also some anti-housing first provisions in there around what the state can and can't do around its money for housing people experiencing homelessness. And it also makes it so that local governments can implement safe camping sites with potable water and portable toilets, but provides no funding to do so. And it also would preempt local governments, basically saying local governments cannot not enforce this law. This is very concerning. Next slide. Okay. Source of income protections, this is something the HHCK has long advocated for. And what we are seeing is potentially a bill that would derail the progress made on that front. In Louisville, they have adopted this ordinance that allows people to use a housing voucher and have it count as income, basically. It's not just a housing voucher, it could be child support income, etc. In Lexington, the LFUCG is looking at adopting a similar ordinance. And there's murmurings about a statewide bill saying no, you cannot, local cities cannot enact such an ordinance. So on both of these things, I would encourage you to stay tuned to calls to action. You can do that by following us on our social media. And next slide, I believe, is the resources around homeless assistance and particularly legal assistance for housing issues. And after that, I will turn it over to Emily Beauregard to cover medical transportation. Next slide.
Thanks, Adrienne. And today I'm going to talk about non-emergency medical transportation, which is a benefit of Medicaid that is very underutilized. Let's go to the next slide. So when I say non-emergency medical transportation, that's essentially the difference between, the ground ambulances and air ambulances that would take you to the hospital in an emergency versus all other types of transportation for medical appointments. And we have this benefit covered by Medicaid for people who are eligible. And we're going to talk about what the eligibility looks like, where the barriers are, and how we can improve it. But what we know is that 60% of Medicaid beneficiaries report having not enough reliable transportation or affordable transportation. It's a real barrier to receiving healthcare services. And in fact, it's the number one barrier that we hear when we talk to providers and when we talk to Medicaid members themselves and boots on the ground, folks like y'all on the webinar today. Let's go to the next slide. So this is the way NEMT is structured in Kentucky. Unlike all other parts of the Medicaid program that are housed in the Cabinet for Health and Family Services, this particular benefit is housed in the Kentucky Transportation Cabinet. And in some ways that would make sense, but really we think that it's not necessarily serving its best purpose there. The way the cabinet handles this or the Transportation Cabinet, they put out RFPs for contract brokers. They award one RFP, one contract per region of the state, and they break the regions into 16 around the state. And then those brokers don't have any competition. And they are paid a per member per month to essentially provide these services, but the incentives don't really line up with better access to care and health outcomes. Let's go to the next slide. Not to say that all brokers are not necessarily doing a good job with this, but we do think that we could realign the incentives to have better outcomes. So in terms of eligibility, the eligibility rules are really strict. CMS, the Center for Medicaid and Medicare Services, federal government, they have always maintained that this benefit should only be available to people who have no other option for transportation. And so what that looks like is that if the Medicaid member has a car in the household, whether it's theirs or not, whether it runs or not, that they basically have transportation, when we know that practically speaking is not always the case, is often not the case, but that is how they often look at, eligibility just as sort of a broad brush. Let's go to the next slide. And in terms of unmet need, when someone has an unmet transportation need, that is really kind of crudely determined. So if there is, a car in the household, as I said, then the individual would have to prove that they have a medical reason for needing this transportation, that there's a work kind of conflict where somebody is using a car for work or for school, or that the car doesn't function. Right now, you need a statement from a mechanic, and how many people are going to be able to get a non-working car to a mechanic and have to pay the mechanic to write that note? It's just not practical. Now, luckily, that's going away. The state is making a good change there. There are also these other statements that can be provided. It just takes some legwork, and often people aren't able to get the transportation even when they're eligible. Let's go to the next slide. And all of this is information that's going to the brokers. You're applying, and your eligibility is being determined by the broker, not by the state, just for context. These are the covered trips. And so it really is comprehensive in what it is supposed to cover. But again, when we look at the reality of the situation, and because we have more of the rules on an upcoming slide, because you have to request this transportation, have it approved, and then schedule it in advance, 72 hours, work hours in advance. It's often hard for people to get to some services that are, maybe scheduled with less notice, especially if that's, urgent care, or if you're trying to get to a pharmacy, that kind of thing. But these are the services that are covered. We can go to the next slide. Now, as I said, transportation is a huge barrier for many Kentuckians, 60% of Medicaid members, but 1 in 15 Kentucky households have no vehicle available. Even those who do have a vehicle in their home often can't use it to, get to an appointment for a number of reasons, because they're sharing it, because it doesn't work, because they don't have gas money, because they don't, the registration isn't up to date. There are so many reasons why we need to provide better access to transportation to more Medicaid members. But you can see on this slide that Destin put together for us. Thank you very much, Destin. Counties, range from having, 1.4% of households without a vehicle all the way up to 21%. And you can take a look at that at their website. We can go to the next slide. So just as an example, if we drill down into McCracken County, and this information is available for every county in Kentucky, you can see the number of Medicaid members in McCracken County is close to 30,000, but the number who have gotten an NEMT trip, about 3,300. So, well, 23,000 compared to 3,300. So what we're looking at is just a very small percentage of Medicaid members who are able to use this benefit to get access to care, when we know that the need is much greater. We can go to the next slide. And these are the regional brokers that I mentioned, the 16, with their contact information. So you can see which broker covers your region and get in touch for more information. We can go to the next slide. These are the hours that the brokers operate for requesting rides and for giving rides. So when you think again about access and having to plan your transportation 72 business hours in advance, so that's not including holidays or weekends, it often means that you're calling a full week ahead. And then the scheduling can also be pretty restrictive. And we have heard stories of people, being picked up late and getting to their appointment late, or being picked up after their appointment very late, the ride never coming back. These things happen. So it's really not convenient. People are really kind of scheduling their lives around this transportation that takes much more time than if they were to have their own car. Let's go to the next slide. So in terms of advocacy opportunities, we have been talking with a lot of legislators who are interested in how we can improve access to transportation, particularly for healthcare. And there may be an opportunity on the horizon for legislation, but the most immediate opportunity is a regulation that is now open. It's recently been amended. I mentioned the change where the state has taken away the need for that mechanic note. And there are some other good changes in that regulation as well, but we could do more and better. And particularly what I would like to see is that we don't just have this one broker operating without any competition in every region, but that instead providers and community health workers and others who have a very vested interest in getting patients to the doctor, to their healthcare provider, are able to provide that transportation and bill for it. So if I can make any change, that would be the change that I would make. But we are going to be putting together a survey, a comment collector to get comments from folks. The comment collection or the public comment period runs through the end of January. So you'll be getting more information about that soon from us, from KDH. Hopefully you've signed up for our newsletter already, but watch out for that. And if there are some problems that do have solutions, like those rides that are showing up late or not coming back, you call the transportation office and you report that. But there are a lot more that we need to advocate for either regulatory or legislative change. With that, I will turn it over to, oh, and there's some more resources here. So we put together a really great explainer on NEMT that tries to distill the most important information into kind of a 2-pager. So that's something that you can share in your communities. And it's also available on KY Loop. All right, back to Dustin.
All right, we're going to talk a little bit about Kentucky's one basic cash assistance program, which is funded through a federal block grant called TANF, and that's KTAP. So let's move on to the next slide. So KTAP, like I said, is funded through a federal block grant, and that means that the dollar amount hasn't actually changed that Kentucky receives for this since 1995, well, actually 1997. But the benefits have been frozen for even longer than that. Last time we had an improvement in our benefits was 1995, which means the dollar amount that people had been receiving for 27 years was the same, even while prices were going up, wages were going up, but the eligibility limit was the same too. So what we saw was a really long, slow decline in enrollment until it bottomed out last year, where only about 21 out of every 100 families were even eligible for the program, let alone on it. Benefits were stuck at around $110 per person per month. Folks were losing that benefit very quickly. So, this was not a very useful benefit up until very recently. So let's move on to the next slide. And I say that because as of March of this year, these benefits there was an overhaul. So the income eligibility limit was increased. The benefit level itself was doubled. There were certain eligibility criteria that were very restrictive that were opened up a little bit. I'll talk more about those. But the punchline is that now benefits are about $199 per person, or about $440 per case. The numbers have gone up, as you saw in that last chart. We have now about 12,000 cases, which include 6,200 low-income parents and almost 22,000 children, some of whom are in out-of-home placements or living with their grandparents. So let's move on to the next slide. So in addition to the benefit improvements I mentioned, higher benefit levels, better eligibility systems, it also allows working parents to keep more of their benefits as they earn more income instead of losing those benefits very quickly the way it was before. It also drops the requirement that parents have to have a work history, which was a big barrier for some, especially very young parents. And it also increases this one-off benefit that mirrors KTAP called FAST. It also includes a lot of work support. So if you need to move for a job, it'll help you relocate. If you need to repair your car, like related to what Emily was saying earlier, there's actually money to help you fix the car you need to get to and from work. It'll pay for work expenses, things like certifications, uniforms, tools, and it'll also provide a post-eligibility tie-off benefit of $200 per month as long as you stay employed during that time. So let's move on to the next slide. The message here is that this was sort of a difficult program to get on and stay on in the past, but it's much better now. So if you know folks who need some help right now raising their kids and they're very low income, tell them to apply. There still are some restrictions, but if they go to Connect, they can find the information they need to figure out if they can sign up. So let's move on to the next slide. So we're going to shift gears here a little bit and talk about childcare, which is one of the largest, if not the largest, expense for young families who have kids who need a quality and affordable place to send their kids. This is something that has gotten a lot of attention over the interim in the General Assembly, And I guarantee you we'll get a lot of attention during the budget deliberations that are coming up here in January. So let's move on to the next slide. Just want to start by saying that this is something that a lot of folks think makes sense very quickly, but also a lot of folks are experiencing, and that's that difficulty in finding and affording childcare is a major barrier to employment, particularly for moms of young kids. So the workforce participation rate for folks 24 to 55 years old who are women and mothers of young kids is 65%, whereas for men of that same age range, it's 93%. So 1 in 5 Kentucky prime age workers have kids who are age 0 to 5, and 1 in 3 parents have had some sort of employment disruption due to childcare issues. So it's a big deal for parents as well as for kids. So let's move on to the next slide. One reason why childcare is so hard to find is that we've been on a really long-term slide in terms of the number of childcare providers we have in the state. So since 2012, there's been a 45% decline in the number of centers. That's about almost 1,650 childcare centers. And the result is that now half of Kentucky kids live in a childcare desert. And so even if it was affordable, which it's not, we're going to talk about that in a minute, it's still hard to find. So let's move on to the next slide. So I mentioned that half of kids live in a childcare desert. 1 in 3 Kentucky counties as a whole are childcare deserts. In Kentucky, there's 162,000, almost 163,000 childcare spots, but there are 261,000 kids aged 0 to 4. There's a lot of kids who might want, their parents might want them to be in a childcare center so that they can pursue a career and so they can provide for their families, but there's just not enough spots to go around right now. So let's move on to the next slide. We do have a program called the Child Care Assistance Program that helps parents afford childcare. It might not necessarily help them find it, but it will definitely help them afford it. There are almost 32,000 current participants in CCAP, which is really great. Compare that to the number of kids who are in public preschool in Kentucky right now, which is only 22,000, or the number of kids in Head Start, which is 12,000. So it's a really useful program in helping parents afford it. But it's still not where it was, say, prior to 2013 when there was a moratorium. So there's a lot of work that needs to still happen to get that rate picked up a little more. So let's move on to the next slide. I mentioned earlier, childcare is expensive. It really is. The average cost for putting your toddler in a mid-sized center right now in Kentucky is about almost $8,900. It's gone up a little bit since I've pulled this data, but just to compare that, full-time tuition at a community college is $5,300. So it costs more to put your kid in childcare in Kentucky than it does to send them to a community college. Full-time tuition at Western Kentucky is about $11,000. So, I think on the one hand, you look at those numbers and you think, man, this is a lot of money. But if you think about it, with college, you can save up through many years. We have tax advantage plans that we've designed to be able to provide for parents saving up for college. For childcare, we're asking parents to pay for this at the low end of their lifetime earnings trajectory and immediately. There's no time to really save up for childcare. So, it is a really huge expense. It's pretty similar to what housing costs are. It's higher than the average family pays for their car payments and upkeep. So it's a very expensive, but necessary service that we have for our kids. So let's move on to the next slide. Just a quick note on CCAP. I'm going to talk a little more about this, but there have been a lot of improvements through a lot of that federal money I mentioned at the top of our time together. One of those improvements is increasing the income eligibility limit. So we moved away from the federal poverty level into a percent of the median income in Kentucky based off household size. So it's actually a lot more generous now and picks up most parents, particularly low-income parents. So let's move on to the next slide. A lot of that money, like I said, went into improving income eligibility. A lot of that money, federal money, actually was designed to send checks directly to childcare centers. That money in particular has already run out. The other source of federal funds, which were designed to do the other things here that you'll see. So creating new childcare centers, creating new family childcare homes, providing scholarships that childcare workers could get an associate's, bachelor's, or master's degree in early childhood development. That money also was used to allow childcare workers to bring their kids to school and have those childcare centers paid for that. It's really been an incredible source of funds that we've put to good work, but all that money is going away. So you'll see here at the bottom, there's a little picture of a monster truck going off of a cliff here. That's sort of the image I have in mind right now with all of these really incredible things we've been able to do. That money's expiring. There's really no roadway set for us. So it's going to be up to the General Assembly to make up essentially what's a $300 million hole, or else childcare centers we know are going to have to raise tuition on what's already unaffordable childcare. They're going to have to cut pay for workers who are already making $12 an hour on average. They're going to have to close classrooms, or they're going to have to close their doors altogether, like they had been doing for the last 10 years. So let's move on to the next slide. I mentioned before, I don't think the state has a lot of money. We're not spending enough right now. And I specifically think we're not spending enough on childcare. So just to put this in perspective, the state pays about $2,600 per kid for K through 12 education right now, but they only pay about $128 per kid for childcare. That's a 20 times difference. And yet we know that 90% of brain development happens in between the ages of 0 to 5 years old, and 10% of brain development happens the rest of your life. So in a lot of ways, we are not investing nearly enough in early childhood in Kentucky. And we have the means to do that right now, and we really should. So let's move on to the next slide. I'll just say this is a slide that Kara's much better at selling than I am. But we are headed toward a budget session, and there are two folks who have a lot of power in making those decisions. And Sheila mentioned earlier that we have very friendly folks answering the phones in Frankfurt. So I encourage you all to reach out to Jason Petrie or Christian McDaniel. They are the chairs of the budget committees in the House and Senate, respectively. And they have a lot of influence on how we spend our money. And so we have an opportunity right now in a way that we've never had before to really put a historic investment into childcare. And I encourage folks to do that. So let's move on to the next slide. We have an explainer that I think will be sent out in the materials. I encourage you all to check out on childcare and the assistance program for it. And with that, I think I'm handing it over to Kelly.
Hello, my name is Kelly Talby. I'm with Kentucky Voices for Health. We'll be covering public health next, which is in large part about vaccinations. Next slide, Alex. This is just a good snapshot of what in a dollar sense and the amount of lives saved every single year just from vaccines alone. You all are here and you do the work you do every day, whether you're a social worker, community health worker, MCO, doctor, or other type of provider. You know what it takes. You see the opportunities, you see the gaps. And a part of how we can achieve those stronger communities is through making childhood immunizations easier to access. It shouldn't matter where any family lives or what type of insurance they have or don't have. They should have access to routine immunizations. And vaccines too, it's really easy to take advantage of, right? They keep us healthy and active, so we go about our day. We don't acknowledge the fact that we didn't amputate a leg or didn't lose a life thanks to those vaccines. So it's easy to take them for granted every single day. But we know, especially in an equity perspective, that vaccines keep children and their families out of poverty. It's fewer sick days from work and school. It's fewer chronic health conditions, fewer disabilities with lifelong consequences. Go ahead to the next slide, Alex. We want our children healthy and thriving. The American Academy of Pediatrics earlier this year published some messaging tools, and the full toolkit is there if you want to go through it. We've cherry-picked a couple options out for you. We really think they resonate. The first is about an instruction manual. It's a how-to guide. It gives our bodies what it needs to respond, and the how-to instruction manual for our immune system to survive a virus exposure. This next one here is about staying up to date, equating it to how we talk about our devices, our phones, our computers. I don't personally really know what Apple is telling me. I just know that the virus protection I had from last month or last year is no longer keeping me safe. And a lot of vaccines are like that, especially when you get into now the COVID immunizations and what that schedule might be looking like, flu or pneumococcal. There's a lot, or TDAP too, throw that in there. There's a lot of immunizations that you just have to continue staying up to date. The version you recently had is no longer keeping you safe. Going to the next slide, Alex. COVID in particular, this one has been tricky to maneuver. It unfortunately became a little political, but we now have some space. We're not so in the moment during the pandemic anymore. And we now know that if you are a Kentuckian and you had COVID between October 2021 and October 2022, if you had that initial 2-shot series, you were 5 times more protected from dying. And if you got that initial booster shot, that 3rd shot there, you were 13 times more protected from dying. And we saw that. We saw at the same time nationally amazing rates of how less ventilator usage, less death rates, weaker infections across the board. And it's difficult. The comment section of any social media platform, social circles, public spaces is so polarized right now. But please keep in mind, at the end of the day, maybe it was a little kicking and screaming, but 91% of Americans 12 years and older got at least one of those first shots. They either got half of that 2-shot series or they got that single J&J shot. And it absolutely opened America back up, what we wanted to see. Go on to the next slide, Alex. It is difficult to keep up with immunization schedules. So here right now is just a very brief snapshot of you can get your flu and COVID boosters right now. Everyone 6 months and older is eligible. There was a lot of talk throughout the year of possibly just immunocompromised populations accessing some boosters. No, everybody go get you a shot. There's RSV vaccines available for 60 or plus group and more there. Next slide. We've put into a less clinical verbiage immunization schedule. If you'd like to access it, we have it both available in English and Spanish. It's just useful, especially for parents. Everything's so busy. Next slide. Any way we can make things more easy to understand, the better. This is a one-stop portal that the state Department for Public Health hosts. We're a part of this co-branding outfit at Kentucky Voices for Health. And go on to the next slide, Alex. But in addition to that one immunization outreach page, please also consider visiting the DPH pages independently, especially right now. It's the respiratory breakout season. Get the latest alerts directly there. We've got to do a better job improving access. You've been hearing a lot today about transportation, childcare, healthcare, all the barriers that stand in people's way, and immunizations are no different. This is a map of our VFC, the Vaccines for Children's program provider map currently, if you'd like to reach out and get to know these folks a little more better. Next slide, please. We've got to increase our VFC providers across the state. And for pharmacists right now, whether or not you know your local pharmacist personally, be like me and just annoy people into maybe doing the right thing sometimes. Next time you're in Walgreens, Kroger, wherever you are, ask them if they service the Medicaid population. If they don't, talk to them about that, send them our direction, send them my personal cell phone if you want. But their provider reimbursement rates just increased. Next slide, please. I know I'm going really fast and we're in fact skipping over, go into the next slide, a whole lot. But if you like what you're hearing and you want to do a more technical deep dive with us, consider joining the Immunize Kentucky Coalition. We meet bi-monthly. Next slide. And these last 3 slides, I'll blaze over real fast because I'm at time already. But community health workers, among many of our trusted messengers, are such a catalyst, improving the lives of Kentuckians. Going to the next slide. We recently were a part of some policy changes that make a lot of Medicaid services billable for our certified community health workers. And while there is a lot of improvements that we feel can continue to be made to these regulations, going to the next slide, there are already strides being made to make these CHW billing processes a lot more seamless for those folks on the ground. We will continue to be a part of that process. We will continue to communicate anytime we see or feel that things could change, whether it make it easier for the CHW in question or the individuals they assist. And with that, I'm going to go ahead and close it because I'm over my time and pass the mic back to Dr. Schuster.
And I will unmute. Thank you, Kelly. Sheila Schuster again, still with the Advocacy Action Network, but also a longtime board member of Mental Health America of Kentucky. And they are one of the oldest, I think the oldest mental health advocacy organization in the country. So if you ever see their logo, it has a picture of a great big metal bell, looks like the Liberty Bell without the crack. That bell is symbolic of a terrible time in U.S. history when we shackled people in the so-called insane asylums to their beds or to a chair with metal shackles. And so when MHA was started I think close to 100 years ago, they melted down some of those shackles and created this metal bell. So we have not done well historically here or in other countries in really understanding all the aspects of mental health, substance use disorders, and treating people the way they should be treated. Next, please, Alex. So you all have heard about ACEs, and these, of course, are not the playing cards. This is the adverse childhood experiences. And I love this slide because the top part of it, the above ground part, is the part that you probably know about from the ACEs questionnaire, where you ask a child, or sometimes adults take them to kind of go back and understand their own childhood traumas. Did you experience substance abuse in your family? Was there domestic violence? Did your family have homelessness? Were one or both of your parents incarcerated? And again, in Kentucky, that's a high percentage of kids. Was there mental illness? Was there divorce, maternal deprivation, physical and emotional neglect? And you get a score. And typically, if you think about somebody having a score of 3 or certainly 4, you're talking about somebody who has a good bit of trauma history. The root causes are what we've been talking about, what you've been hearing about here on Thrive. So if you think about poverty, you think about systemic discrimination, poor housing, certain equality and affordability, violence, community disruption, lack of opportunity. So if you think about what Dustin talked about in terms of economic mobility and social capital, and obviously we have many families that have food insecurity. So think of the pressure on those families that are thinking day to day, am I going to be able to feed my children? Next slide, please. So there are now have been identified what we call PACEs, or positive childhood experiences. And the most recent literature was very encouraging that you could actually overcome some of the traumatic effects of the ACEs by filling kids and even adults full of these positive childhood experiences. So they have to do with a sense of belonging, a sense of being supported, a sense of feeling safe and protected. We also know that those are factors that help with school safety. The research is very clear that if a student has even one adult that is a trusted confidant in the school, that there's better school safety there, because if that student hears something, they will say something. Doesn't have to be your your school psychologist. It probably won't be. Maybe the lunchroom lady or the secretary in the principal's office or the bus driver or a favorite teacher, that kind of thing. So again, these positive childhood experiences and with adults are very important. Next, please. So just like we have social determinants of physical health, we have social determinants of mental health. And as you read through these, they're going to look a lot the same. Underemployment, again, food insecurity, housing instability. If I had a magic wand, the Dr. Schuster magic wand, I would attack poverty, which is really, really probably the root cause of so many of these things that we list here, either on ACEs root causes, but also these social determinants of mental health. So poor access to healthcare, which is something that this coalition works on so strongly, and particularly Kentucky Voices for Health. That's why what Priscilla talked about making sure that people don't accidentally get kicked off Medicaid gets to be so important. Next, please. So I'm very excited. I've been working for 20 years in the legislature to provide a special program, which is available through what we call a Medicaid waiver. And this would be for Kentuckians with severe mental illness. So these are illnesses like schizophrenia or bipolar disorder or schizoaffective disorder. And what we hear from those consumers of services, as well as their family members and from providers, is that what they really need is supported housing and supported employment. So supported housing would give not only the roof over the head, that's an important part, but it also would have someone checking with the person on a daily basis, make sure that they're taking their medication, that they're getting to their therapy appointments, and so forth. And the cabinet is in the process where we've been having meetings at 5 locations around the state. The last one was yesterday, but there will be opportunity if you have an interest in this. We will be getting information out about how you could comment on what is being proposed, because we want, if we're going to go through all this trouble to get a waiver, we really want it to do what we need for it to do. So I'm excited, but cautiously optimistic, I'll say. Next, please. So one of the things that happened in this last session was a terrible bill. I'll be real honest with you. It was called Senate Bill 150, and it was the it was the ugliest, I'll say, of the anti-trans legislation of any state in the nation. And we hear this from our national counterparts. It not only affected and cut off access to physical and in some cases mental health care for kids that are identifying as transgender, but it also puts some changes in the school system that affect not only trans kids, but all LGBTQ kids. And so the school environment is going to be less supportive, less welcoming. There's going to have to be separate bathroom facilities for kids that identify as trans. We're going to be cut off from information that we've been gathering every year about the mental health status of our students. And there's just a really negative, I'm hearing from school teachers, school counselors, school personnel, that they're really struggling to get back to really supporting these kids. So be watchful, be kind and affirming if you know trans kids or LGBTQ kids and their families, to be kind and supportive to them. Next, please. So unfortunately, one of the things that Kentucky ranks high on is suicide or self-harm. And you see the statistics here, and it's really across almost every demographic. So there's been an alarming increase in suicides among adolescent and college-age Black males. We're also, unfortunately, seeing suicides of very young kids. And my concern is that very young kids don't have the cognitive ability to understand that death is really permanent. So they are so hurting and they do something not really thinking about the consequences. We're seeing a lot of it among farmers. And there's a very helpful resource here, a group called Raising Hope Kentucky, and that website is on there. We also have the National Trevor Project. And so we have that, those helps available not only locally, but through them. They have trained people to answer the 988 calls, specifically if there are LGBTQ issues that are being raised. Next, please. So I hope you're familiar with the 988 Suicide and Crisis Lifeline. It was launched about a year and a half ago. It's nationwide. And I want to brag on Kentucky. I don't often get a chance to brag about Kentucky's mental health, but we're doing a better job of having call centers. We have 12 call centers across the state. So the important thing is that if you call from a Kentucky area code, you will be answered locally. And I think this is critically important to get services to you. Also, when you call or text is also available on 988. If you're a veteran, you can press 1 and you will be connected to other veterans. If you're a Spanish speaker, you can press 2 and get instruction and conversation in Spanish. And then for the Trevor Project, which I mentioned earlier, you can press 3. Next, please, Alex. So I mentioned 12 call centers, and that's because Kentucky was one of the first in the nation in the 1960s to establish literally a statewide community provision of services. So we have 14 community mental health centers. You see them listed there, and you see their catchment areas. They roughly reflect the ad districts or the area development districts, and they're part of the state. And they have services available to all of the counties for which they are responsible. And they're the ones that are operating the crisis call centers and responding to those urgent requests, providing resources and so forth. Next, please. So you all are very familiar with the opioid crisis that has brought so much attention to all of our addictions here in Kentucky. Let's not forget, we still have a lot of people that are alcoholics and under the influence of alcoholism. We still have people that are doing an inordinate amount of pot smoking and so forth and using other drugs. But the opioids have caught our attention because of the incredible number of Kentuckians that we've lost to overdoses. So Narcan is the solution immediately. It's now available over the counter. And you probably have heard in some communities, they actually have vending machines that don't require money and they have them set up. They're equipping schools now with these first aid kits to include Narcan, easy to administer. And if somebody has an opioid overdose, can be life-saving. The other change in legislation was very important, and that was that it made fentanyl test strips available. They had previously been considered drug paraphernalia, but now we know that a lot of people are purchasing drugs from the black market, not trying to purchase fentanyl. They're trying to purchase, an ADHD drug or an anxiety drug or whatever, and they are laced with fentanyl. So these test strips are available so that you can check those street drugs to make sure they don't have fentanyl. The problem is that fentanyl is so deadly that the slightest amount in that pill is a killer. Next, please. So this is just a brief kind of reminder about taking care of yourself and being aware of changes in your own irritability or difficulty in sleeping or increased use of alcohol and other drugs and so forth. Get some feedback from your loved ones, get some feedback from your primary care provider. There is help out there. Mental Health America has some screenings that are confidential and very good at giving you kind of a quick feedback about where you might be, and the link is in there. When in doubt, reach out for help, and it's better to do it early on. And I think I have a final slide. Yes, mental health help is available. So you have 988. You again have the screenings from MHA, the crisis text lines, and the Trevor Project. So take care of yourself and your mental health so that you could help take care of others. Thank you. Oh, and my favorite thing, and this has to do with advocacy, never forget that a small group of thoughtful people could change the world. So I hope that you all have, who have been on this webinar with us, will be that group. And I look forward to hearing about your advocacy. Thank you.
Well, thank you, Sheila, and I'm going to wrap us up now. One resource that I just wanted to draw everyone's attention to is KY Loop. So this is not only a forum that we've talked about, on previous calls, but also has a library of resources that we've tried to really keep up to date and focused on these different needs and programs that we've talked about today. So the Thrive Kentucky explainers in particular that we have shown for various topics, they all live here on KY Loop, and we've had them all translated into Spanish. So we hope that you will make use of those, sharing them in your community and helping us to, improve the information if need be. And as there are, more areas of need, we'll try to continue to put out those explainers, and we'd love your feedback on them. But there are a lot of other resources there as well. And if you have any questions for us about, a particular program, if you're facing a particular barrier, you can go on the forum, submit that question, and we will get an answer to you. We know that it can be hard to find information. It's hard to wait online at the DCBS call center. And if we can help, we'd like to do that. So let's go to the next slide. The Advocacy 101 training that we talked about earlier, that's happening January 8th. Here's the flyer and the registration link. And Sheila and I will be joined by Representative Lisa Wilner and Representative Kim Banta. So we hope you'll join us that day. And even if you've done it before, it's always a good refresher. I always learn something new. So please tune in and share that information with your networks. And let's go to the next slide. Looks like we're okay. There we go. Just another reminder about upcoming events that we have. We have KY Policy has our conference on the 19th of January, and we'll have another Thrive Kentucky webinar, our usual state and federal policy updates, but also a lot of information about the legislative session on the 22nd of January. And then we'll be having our forum, which is, typically quarterly with the Cabinet for Health and Family Services on the 12th of February, and then back to our state and federal policy updates in March. But please register for those. We have an evaluation. We'd love your feedback on our Roadshow series, and hopefully we'll see you on before May for our next Roadshow, but at one of these upcoming events. Alex will be sending out a follow-up email with the slides, with the recording, with all of these resources, with any of the information, questions, answers in the chat. So you can watch for that as well. And I know the holiday season is upon us. This might be the last day for some of you working this year. So happy holidays, everyone. Thank you again for joining us, and have a good weekend.